Okay, my name is Landon, and I am a dental hygienist. I work at a dental office, and I absolutely love what I do. I clean teeth, but that's not all that I do. And I'll give y'all a little bit more info with that in a second. Okay, so there's a couple different ways that you can become a hygienist. The route that I picked was going to a university program. I went 2 years to University of Mississippi, and then I got all of my credit, my prereqs for getting my bachelor's degree. I transferred to University of Mississippi Medical Center. So strictly, it's a 2+2 program: 2 years of prereqs, 2 years of your clinical school. So you can spread it out if you wanted to. I wanted to be done with school, so I did the 4-year route, and I was able to get my bachelor's degree, bachelor's of science in dental hygiene. You can also go the route of getting a few prereqs, but getting your associate's degree. So a lot of people do that in Tennessee, where I was from in Mississippi. I lived right by the university, so I wanted to get my bachelor's. But you still get the same training. Um, it's just a great thing that you have both options here in Tennessee. I chose to be a dental hygienist when I was in high school. I knew that I wanted to help people. Um, I always wanted to be a teacher, and I'm still teaching my patients just in a different form. And I loved going to the dentist. I loved the way they made me feel. They were so nice to me, and I loved having clean teeth at the end of it. And that's just the beginning of it. I realize how much it entails now, but starting out, those were my main reasons to become a hygienist. My typical day is very, very busy. Um, I see anywhere from 8 to 14 patients a day. So it is slam packed, but I love my schedule. I start super early. I start at 6:30 and I'm done either by 3 or 4 o'clock. I do get a lunch, but I'm very busy. It's fast paced. Not only am I seeing my patients, I'm also seeing the doctor's patients, whether I help her get x-rays or I help the dentist get the patient numb. But I'm very interactive with my patients. Whenever I see a patient, I've got to assess their health, their overall health, their oral health. I've got to see, do they need x-rays? Um, do they need a certain type of cleaning? Do they need special treatment? And not only from there, I'm not only in the preventive aspect, I am getting them ready for the restorative aspect. Do they need fill-ins with a dentist? How can I set up their appointment? How can that make their life easier at the appointment process? I loved helping people. I don't know if that's considered a hobby, but I loved helping people. I was very active. I did dance. I rode my bike. I did cheerleading. I just loved being around people and always being on the go and trying to do the best that I could in each aspect. So I think just being active and being around people helped me in this profession. Okay. Oh my goodness. My first job was back in 2011. It was kind of after the recession, so it was a hard time to find a job. I had to take over someone's maternity leave, and I was very grateful, but I worked in a really small town, a very small clinic. We did not have digital x-rays. You had to go in the dark room and develop film. So I am very appreciative of what I do now. I can take digital. I love this guy. But it was very good though. I learned so much. I was the only hygienist there. I had to teach myself a lot of things. But another thing that I loved is I worked with kids mainly. And then we also saw a special needs facility. We were the only dental office that worked with them. So not only did I get the experience of having, general patients, I also got to see special needs ranging from, different forms of autism or any type of abuse or just any type of things that we're not used to seeing on a daily basis. It also helped prepare me for people who have dental fear or anxiety. I just learned so much. It was the backbone of my career. I'm very thankful for it, but I'm also thankful for the advancements of technology. And it was just a great beginning. Okay, so here's a good answer. A lot of times people think you're the hygienist who just cleans your teeth. That is not it at all. There's so much more that we do, and I feel like hygienists and the dental professionals don't get credit for. Your mouth is related to your whole body. If your mouth isn't doing good, your teeth aren't doing good, your gums aren't doing good, then it can affect your heart. Think about if you're bleeding, you got bacteria in your blood from your mouth that's causing gum disease. Where does that blood go? It filters in your heart, your kidneys. It can spread throughout. And so it's so important to make sure that you have your dental checkups. One other thing I want to mention is we don't just clean teeth. We help fix your smile. We can whiten your teeth. We do Zoom laser whitening where you can see so many changes. We are preventive. We help strengthen your enamel. We educate. We tell you how to brush. We tell you how to floss. It's not just coming in for your cleaning and a checkup. It's an overall health checkup. Never give up. It is so hard because people think it's a breeze. You're just cleaning teeth, like I said. But don't give up. Push yourself. Know that the patient is the most important thing and that chair, and you'll get to the next patient later. Make sure when if you ever wanted to do something in the dental field, you look for a job that has benefits for you. A lot of places do not offer that. And so make sure you find a good place with a great doctor that's going to take care of you, and you look for health insurance. If they offer a dental package for you, a lot of the times it's just within the office you get your dental care, um, or 401k. Make sure you look into those things because, yes, great to have a job, but you need to be protected outside of your job too.